Hello and welcome back to my channel, which empowers aesthetic excellence. I am Dr. Bhavna Agarwal, and this is a new series, which is the Pro Injector series, which I'm starting. And the first topic that I wanted to discuss is the needle versus cannula, because this is the ultimate injector's dilemma. And this is a question, when I go to trainings, this is something which I'm very often, confronted with, whether to use needle. Can we use only needle? Can we use only cannula? So this is, I think, is important if somebody is into aesthetic injectables to know that although the video states it is the battle of the tools, but I will now, by the end of the video, we might rephrase it to something like the coalition of the tools. So without any further delay, let's get started. So I would like to start to tell you that how I began, or maybe most of the aesthetic injectors 10, 15 years back began, and then how things are as of now. So when we started injecting, it was basically only the needle that was, provided with the filler in the box. And we always, it was, understood by default that needle is the, we have to use needle only. We never knew that cannula was also a choice. So we were doing all the indications with cannula. But then over the years, as aesthetic injectables started gaining momentum, there were few injectors who were new at that moment. They thought that, needle was, they were scared of using needles because of the probability of some major complications, which is why they started, practicing with cannula, and which is comparatively safer, but, that is again a topic of discussion. Also, then gradually over the period of years, people also felt, because cannula has the advantage over the needles in being, less traumatic with less entry points. But so there were, now as of now, what we say is, again, I said by the end of the video, we will know why it should be coalition of the tools and not the battle of the tools. It is like there are some indications where cannula works best, and there are some indications where needles work best. So earlier, the choice of using cannula versus needle was the ease of injection, or the, patient confronting the patient fears. Needles, people are, they are afraid of needles, and with cannula, they're, less, from being less traumatic and less painful comparatively. Again, pain is subjective, but somehow people felt more comfortable using cannula. So it is not the comfort of injecting or comfort of the patient by which we make a choice whether to use needle or cannula. It is basically, there are some indications where cannula works best, and then some indications where needle work best, which we'll be discussing in the video. And also in this video, I'm discussing the injection application and techniques of using needles and cannula. There are other parameters to this topic, which I will be taking up in the subsequent videos. So without any further delay, let's get started. So talking about the needles first, needles are best suitable for places where we need precise placement of filler, and also deep placement, that is on the periosteum, and precise placement. Although needle can be used to, inject superficially also, but this is something which is indispensable. The periosteal placement of the filler is indispensable to needles. There is no other device or any other tool which can help us uh, place the filler at that plane. Now, considering that 50% of the facial changes of the aging are contributed by the periosteal resorption or periosteal changes. And adding a side note to this is that fillers will always be in and needles will always be in, because this is the combination which can help us overcome the periosteal changes. There is no other device, there is no other tool which can, help us deal with these indications. So coming back to the topic, needle is indispensable and the best where filler placement needs to be precise and needs to be deep. Example, periosteal plane, for example, lateral cheek, the angle of the mandible, the chin elongation. These are the areas where needle is indispensable. So if you're doing these with cannula, and also one difference which I want to add is needle will give, what we say as sharp contouring, and cannula will give a diffuse and soft contouring. So that is also one thing. So wherever you need some sharpness, needle is again indispensable. Then also needle can be used in all the layers, as I said. It is quick. The needle use is quick and it is localized. But again, for a large area, if you're using, multiple pricks are required, which is the downside of it. And also the uniform deposition of the product in a large area, if you have to layer it, is uniform deposition is slightly difficult. It's more easier with a cannula as compared to the needle. So this was about using the needle. Now, second, when we come to cannula, the application techniques and all. So cannulas are ideal for injecting filler into broader areas. For example, anterior cheek, the nasolabial folds, the anterior chin, because they distribute the filler in the larger areas with minimal tissue damage also and more precision. The distribution, the layering is more precise as compared to the needle. Also, the cannula glides through the planes easily. If you're in the light plane, it glides through the plane easily. And there are less chances of VO, but this is again debatable with, as I mentioned. So there is minimal risk, as many people understand. So when with needle also, the risk is minimal if you are very well versed with the injector's anatomy. If you know which plane the artery is in, other than bruising, with needle also there are very little chances of any major complications. But then that is how people think sometimes. So cannulas are preferred where volumization is required. So, and soft contouring, as I mentioned. So some people prefer sharp contouring and some prefer soft contouring. So this was about the application tools and techniques and applications of needle versus cannula. And as I mentioned, it is not the battle of the tools. It is the coalition of the tools that works best. So that is what I think was important here to mention. If there is something which is, if there is any doubt that you have regarding this, do mention in the comments below. I'll help to, answer that also. And stay tuned for the series for the next videos, because I'll be taking up needle versus cannula, a lot of aspects of these two techniques, these two tools. So thank you for watching, and see you in the next video.